Welcome to the deep dive. Today, we're going to cut straight to the chase on something really crucial in health. There just aren't any quick fixes.
That's right. We all want that instant solution, don't we?
Absolutely. But what if understanding why lasting improvements need, well, a bigger picture approach actually helps you more in the long run, moving beyond those temporary Band-Aids?
Exactly. And we've gathered some really interesting sources to look at this. We're drawing from Joint Commission International, JCI, and India's NABH, the National Accreditation Board for Hospitals and Healthcare Providers. These are big names in setting standards.
Okay.
And we've also got perspectives from Supremedics, their healthcare consultancy, some practical bits from HospiMatch blogs, and articles that really unpack how complex health actually is.
Right. So our mission today is pretty straightforward. Dive into why healthcare progress is, well, more of a journey, maybe not a quick pit stop. We want to highlight the real risks of chasing those easy answers and ultimately help equip you with a more, let's say, effective long-term way to think about your health and the healthcare system. Sound good?
Sounds great. Let's get started.
Okay.
So first things first, the fundamental truth. Healthcare. It's really a marathon, isn't it? Not a sprint.
Yeah, definitely feels that way sometimes.
Well, think about the human body. It's just incredibly intricate, like a whole ecosystem. The Supremedic Lifelines podcast really nailed this. Your health is shaped by so many things interacting.
Like what exactly?
Well, your lifestyle, obviously, but also your environment, your genes, even your mental state. It's not just one thing you can point to and fix overnight. It's multifactorial.
That makes sense. It's like trying to fix one gear in a really complex watch without understanding how all the other gears work together.
Precisely. And when you do get sick or need surgery, or maybe you're managing a chronic condition, healing itself has its own pace.
Right. It's not instant.
No. Supremedic's Lifelines also mentioned this improvement is usually gradual. Our bodies, they just need time to repair, to adapt. Patience is, honestly, often the hardest part, but it's so crucial.
Especially when you just want to feel better now.
Exactly. And even before healing can start, you need to know what you're dealing with, right? That means proper assessment and diagnosis.
The groundwork.
Yes. And doctors, nurses, they need time for that. Thorough exams, ordering tests, waiting for results, following protocols. It all takes time to get an accurate picture.
The Lifelines podcast mentioned that too, didn't it? About not rushing diagnosis.
It did. It's like being a detective. You can't solve the case properly if you rush gathering the clues and analyzing the evidence.
Okay, so healthcare is complex, healing takes time, diagnosis needs care. That sets the stage.
Right.
Now, what about those tempting quick fixes? Why are they potentially dangerous?
Well, one big pitfall is expecting everything to be sorted after just one doctor's visit.
Ah, yes, the one and done hope.
Right. But Supremedic really emphasized, especially with chronic conditions, it often takes multiple visits, different tests, maybe some trial and error with treatment. That first appointment, it's often just the beginning.
Just step one. Okay.
Then there's the whole self-diagnosis rabbit hole online. We all do it, search our symptoms.
Guilty. So easy, right?
It is, but it's risky. The Supremedic Lifelines discussion hit this hard.
Yeah.
You can easily misdiagnose yourself, or worse, start some kind of self-treatment that's actually harmful.
Or just delay getting the right help.
Exactly. It's like trying to fix your car engine based on a forum post from someone with a totally different problem. You can make things much worse.
Yeah, not a good idea. What else?
Skipping follow-up care. This is a big one. You start feeling a bit better after the initial treatment.
And you think, great, I'm cured.
Precisely. But those follow-up appointments are vital. They let the doctors track your progress, adjust the treatment if needed, catch problems early. Supremedic pointed out that stopping treatment too soon or just not showing up for checks,
Can set you right back.
or worse, it really undermines the whole recovery. Like stopping antibiotics halfway through just because you feel better. That's asking for trouble.
Okay, that makes sense. Any other pitfalls?
Yeah. One more the Lifelines podcast touched on. Sometimes we prioritize immediate relief over the doctor's long-term plan.
Wanting the quick symptom fix instead of addressing the root cause.
Exactly. You might push for something that gives instant results, but ignore the lifestyle changes or the longer medication course that offers the real sustainable benefit. Trusting the doctor's guidance, their broader view, is key.
So it really boils down to needing patience and trust and understanding it's a process.
Absolutely. Which leads us nicely into how quality and safety are built into healthcare systems. It's not quick either. Think about organizations like Joint Commission International, JCI.
Right, you mentioned them. Global leaders in quality and safety.
That's them. Their mission, stated right on their site, is to enable and affirm the highest standards of healthcare quality and patient safety for all. They've been doing this for over 20 years, across more than 70 countries.
Wow, that's extensive.
It is. They've accredited over 1,000 programs, and they offer a lot of international standards, accreditation, specific certifications for clinical care, sustainability, even telehealth now, plus advisory services to help hospitals get there.
So they're not just setting standards, they're helping organizations meet them.
Yes, and fostering collaboration too. They have this event, Unify 2025, coming up, all about sharing insights to solve healthcare challenges together. It's about collective improvement.
And do hospitals find this process valuable?
Definitely. We've found some great testimonials. Alex Lan in Hong Kong mentioned stronger teamwork. Shiji Kurian at Burjeel Farha saw more community trust and better risk management.
Okay.
Imad Sadek from Emirates Hospitals Group talked about added value and patient confidence. And Roxana Fulton at Corniche Hospital spoke about their ongoing commitment to excellence because of JCI. These aren't overnight results, it's deep systemic work.
A long-term investment in quality. And you also mentioned NABH in India.
Yes, the National Accreditation Board for Hospitals and Healthcare Providers, part of the Quality Council of India, setting those benchmarks specifically for the Indian health industry.
And consultancies like Supremedic help hospitals with that process.
Exactly. They guide providers through NABH accreditation, focusing on implementing best practices for operations and performance.
So whether it's JCI internationally or NABH in India, the message is the same. Building quality and safety is systematic. It's long-term.
No shortcuts there either. It really reinforces this whole theme.
It really does. And this long-term thinking, it applies beyond just accreditation, right? How we approach healthcare challenges generally.
Absolutely. Take workforce issues, for instance. Staff shortages, high turnover.
Yeah.
These are huge problems.
We hear about them all the time.
Right. And sources like the article discussing ShiftMed point out that temporary staffing, while maybe helpful in a pinch, isn't the solution. You need strategic planning, real employee engagement, efforts to retain staff, improving the work environment itself.
Sustainable solutions, not just plugging gaps temporarily.
Precisely. And the same logic applies to our personal health. Lasting improvements. They don't come from fad diets or those miracle cures you see advertised.
No magic pills.
No. The article on No Shortcuts to Lasting Health was clear. It's about consistency. Regular exercise, balanced nutrition, managing stress effectively. These are ongoing commitments.
Building healthy habits over time, like building that strong foundation for a house, as you said earlier.
Exactly. And then there are the big systemic challenges. Rising costs, access disparities.
Issues we see debated constantly in the U.S. and India, everywhere.
And again, quick fixes like just cutting budgets or ignoring prevention, they don't work. Articles discussing these systems highlight the need for comprehensive solutions. Things like funding reform, smart policy changes, using technology better, focusing on equity.
It requires a much broader, more strategic approach.
It does. And finally, let's not forget prevention and community health. That Wikipedia entry on community health really underscores its importance.
Preventing problems before they start.
Yes, or catching them early. Community-based programs addressing those social determinants of health, things like education, housing, jobs. That's where you make a lasting difference for whole populations.
So again, long-term vision, not immediate intervention.
Right. And for you listening, understanding all this, these sustainable approaches, it's about finding a path to genuine, lasting well-being, rather than constantly searching for that next quick fix that probably won't deliver.
Okay. So as we wrap up this deep dive, the core message seems really clear. Sustainable health, quality healthcare, they aren't things you achieve with shortcuts.
Not at all. They're built piece by piece through consistent effort, smart planning, and a real commitment to comprehensive approaches.
It's about understanding that progress, whether it's for yourself or the healthcare system, is really a continuous journey. There's no instant arrival.
And knowing that, embracing that reality actually empowers you. You can approach your health, your doctor visits with more realistic expectations, which usually leads to better engagement and hopefully better outcomes.
Yeah, managing expectations is key. So here's something for you to think about as you go about your day. What part of your own health journey, or maybe how you view the healthcare system, could really benefit from shifting away from seeking a quick fix and adopting more of a long-term perspective?
That's a great question to ponder. And if you want to explore further, the websites for Joint Commission International and NABH are excellent resources for quality standards. And for insights on the management side, Supremedic's materials offer valuable perspectives, too.
Great suggestions. Ultimately, just remember, true progress in health isn't about finding that magic bullet. It's about embracing the journey, the continuous path towards well-being. Thanks for taking this deep dive with us.